We don't advise that you rub the eye. Now, the danger of rubbing the eye is that you can endanger the cornea, which is the black part of the eye. And when the cornea gets a problem, it can become a big issue. Right, so today we want to look at what we call ocular allergy, or mostly termed as allergic conjunctivitis. And then before that, we want to look at one myth. Mostly when I sit in the consulting room and people come with itchy eyes, one of the things I hear them talk about is that they say it's piles, what we term hemorrhoids, or in the local language we call cocoa. Yeah, but we want to say that piles do not grow on the eye. Piles do not grow on the eye. Now, allergic conjunctivitis is what makes your eye to itch. Anytime you start rubbing your eye, you feel the eyes are itchy, it is a sign that you are having what we call allergic conjunctivitis. There are other symptoms that come along with the itching. One of them is a reddening of the eye, the conjunctiva. One of them is excessive tearing of the eye. And most of the times you will also have some eye discharges. Now, how do allergic conjunctivitis come about? Now, we know that it is an immune response to what we call an allergen. An allergen is anything the body considers as foreign. So once the allergen gets into contact with the body will produce an immune response to the allergen. So in the immune response, inflammatory cells are released to combat the allergen which is in the body. And one of the inflammatory cells that are released is what we call a mast cell. Mast cell comes and then opens up and its contents release. Histamine is released in the system and then it triggers the itching. So anytime your eye starts itching, it is a sign that you have come into contact with something that the body considers as an allergen. Now, what do you do if you don't have any medication with you? We don't advise that you rub the eye. Now, the danger of rubbing the eye is that you can endanger the cornea, which is the black part of the eye. And when the cornea gets a problem, it can become a big issue. And so we mostly advise people that if you start feeling itchy eyes, you get a clean towel, you soak in a cold water, and then you put on your eye, massage it gently, and then you can get some relief. When you come to the hospital, we have anti-allergic eye drops, oral medications that we can give to relieve your symptom. But that is just to relieve your symptom. Now people come and they say, oh, I came, they gave me medication, I used it, and then the condition came again. Yes. Once you're given eye drops, the eye drops are there to relieve the symptom. But because this allergic conjunctivitis is triggered by an allergen, anytime you come into contact with the allergen, there will still be that immune response to it. So yes, you may treat the condition today, that if the allergen comes again, it will still trigger and you will have to treat. And so what I mostly advise my patients to do is to look out for the specific allergen that is triggering the immune response. And so some of them will give them a whole lot of things to do. Others also do that and they are not, so we refer them to do an allergy test. The allergy test is able to bring up a whole lot of things. The food allergy test gives you a lot of foods that you are allergic to, and then we look at them and they will make you stay away from. So if you're able to identify the specific allergen and you stay away from the allergen, you are good to go. In fact, the permanent solution is to identify the allergen and stay away from it. Because at any point in time when the allergen comes in there, it will trigger an immune response. So number one, understand that we don't want you to rub your eye, and we don't also want you to go and buy cocoa medications for piles, because piles don't grow on the eye. In our next video, we will look at some signs and symptoms of allergic conjunctivitis, and we'll go into details how the itching comes.